sleep with? Are you cheating on me? What's that smell? What are those thick white discharges from your vagina for? And the woman, on the other hand, will be panicking. Hello, friends. Welcome to Sab's Health Corner with Levi Sabatina Obochoma. And today we are going to be discussing vaginal yeast infection, also known as candidal vulvovaginitis. And before I begin, I want to make it clear to you that candidal vulvovaginitis or vaginal yeast infection is not sexually transmitted and it is highly treatable. So let's dig in. Vaginal yeast infection is a type of fungal infection where the vagina is swollen, painful, and possibly infected. It may be strange to think about, but fungus lives in several places within our body. The yeast that we have living in our mouth, digestive tract, and the vagina is known as candida. Yeast is a type of fungus and candida is a specific type of yeast. When this yeast is imbalanced within our body, there are no problems. But when the yeast is out of balance, it rapidly grows and you can get a yeast infection. Candida, on the other hand, normally doesn't cause a problem. It is supposed to be in our body and other bacteria help keep its growth under control. However, certain factors make it hard for good bacteria to fight off the bad bacteria in our body. Sometimes bad bacteria wins and you end up with an illness. So let's look at symptoms of vaginal yeast infection, which includes an itchy or burning sensation in your vagina or vulva, a thick white vaginal discharge with the consistency of a cottage cheese, redness and swelling of a vagina and vulva, small cuts or cracks on the skin of your vulva because of fragile skin in that area, a burning feeling when you pee, and pain during sex. Symptoms of a yeast infection are similar to the symptoms people feel when they have a sexually transmitted infection. That is why most times people mistake yeast infection to be a sexually transmitted infection. So let's talk about causes of a vaginal yeast infection. Anyone with a vagina can get a vaginal yeast infection. They are most common after puberty and before menopause. When the bacteria in your vagina is out of balance, it causes candida to multiply. And this happens for reasons like 1. Taking antibiotics. Antibiotics that treat infections in your body kills the good bacteria in your vagina that keeps the yeast in check. And without these good bacteria, this balance is altered, leading to a yeast infection. 2. Pregnancy and hormones. Anything that disrupts or changes your hormones can disrupt the balance of candida in your vagina. This includes being pregnant, using birth control pills, and normal changes during your menstrual cycle. Number 3. Having unmanaged diabetes. High blood sugar imparts the bacteria in your pee. This increase in sugar can cause yeast to overgrow, particularly in your vaginal area, and your body develops a yeast infection in response. Number 4, having a weakened immune system. If you have a disease like HIV or AIDS, your medications can suppress your immune system. Chemotherapy and radiation treatment for cancer also suppress your immune system, making you prone to yeast infections. Ways to reduce risk of a yeast infection includes 1. Not douching. Douching kills bacteria that actually controls fungus. Number 2. Avoiding the use of feminine deodorants. Number 3. Not using scented pads or tampons. Number 4. Changing out of wet clothing like bathing suit or gym clothes as soon as possible. Number 5. Wearing cotton underwears and loose-fitting clothes. Number 6. Using a water-based sexual lubricant. And the last but not the least, keeping your blood sugar level in a normal range if you have diabetes. So let's look at the management and treatment of vaginal yeast infections. Vaginal yeast infections can be treated using antifungal medications. And this specific medication depends on the severity of the infection. So your healthcare provider will prescribe the best treatment based on your symptoms and conditions. Antifungal medications work by fighting yeast overgrowth in your body. This may take a few days or a full week, or may even last longer. Please do not stop your medication too soon, or the infection may come back. This yeast infection doesn't go away on its own. Only a medication that destroys fungus will treat a vaginal yeast infection. It is also advisable not to have sex while taking medication for a yeast infection until you're finished with treatment, because sex can cause more irritation, and certain antifungal medications can weaken materials used in condoms and diaphragms. Thanks for your time. Please like, share, subscribe, turn on the notification button to always get my videos first hand. See you in my next video. Bye bye.